I'm Matthew Gonzalez.
I'm Will Palmer.
And we did our presentation over depressants. What are depressants? Well, central nervous system depressants, CNS, sometimes referred to as sedatives and tranquilizers, are substances that can slow brain activity. They produce a drowsy or calming effect beneficial to those suffering from anxiety or sleep disorders. Some common depressants: Valium, Xanax, Ambien, Lunesta, and alcohol.
Types of depressants. Barbiturates are drugs that are used as sedatives and sleeping pills. Benzodiazepine is a tranquilizer that acts to relax muscles and calm mental excitement. These drugs can increase the risk of high blood sugar, diabetes, and weight gain. Instances of up to 100 pounds have been reported.
Cool, what's the problem? Well, the body can become dependent on them in a matter of days. During the first few days of taking the depressant, a person usually feels sleepy and uncoordinated. Then the body becomes used to these side effects and symptoms lessen. This is known as tolerance, which means a person has to take more of the drug to get the same initial effects.
Who would do that? Quite a lot of people, actually. 1 in 10 Americans are on depressants. 2.4 million reported abusing prescription drugs. Half of those were female. 1/3 were aged 12 to 17. In a study conducted by USA Today, based on Food and Drug Administration data over a 4-year period, antipsychotics, which is a type of depressants, were the prime suspect in 45 deaths caused by heart problems, choking, liver failure, and suicide.
Alcohol as a depressant. Alcohol influences your brain and leads to a loss of coordination, slowed reflexes, disordered vision, memory lapses, and blackouts. Alcohol leaves feeling of warmth, flushed skin, impaired judgment, lack of coordination, slurred speech, memory and comprehension loss. Heavy drinking usually results in what we call a hangover. Headache, nausea, and anxiety, weakness, shakiness, and sometimes even vomiting.
Alcohol statistics. Alcohol kills more teenagers than all the other drugs combined. A U.S. Department of Justice study found that as many as 40% of violent crimes occur under the influence of alcohol. 39% of all traffic deaths involved alcohol in 2005. In 2005, 6.6% of the U.S. population aged 12 or older, or 16 million people, reported heavy drinking, binge drinking on at least 5 days of the past 30 days.
Well, how do they work? Most depressants affect the brain by increasing the activity of gamma-aminobutyric acid, or otherwise known as GABA, a chemical in the brain that sends messages between cells. The increased GABA activity in turn slows down brain activity. This causes a relaxing effect that is helpful to people with anxiety or sleep problems. Too much GABA activity, though, can be harmful.
Other side effects. As depressants slow down brain activity, they cause other effects. They cause slurred speech, shallow breathing, which can lead to overdose and even death, sleepiness, disorientation, and lack of coordination.
What's the long-term effects? Well, if one person uses this drug, long-term, large doses may be needed to achieve the therapeutic effects. Once the body becomes more dependent, if use it subtly stops, some depressants can be life-threatening. When an individual stops taking them, there can be a rebound effect, resulting in seizures or other harmful consequences.
How do people deal with depressant abuse? Someone who is thinking about continuing CNS depressant therapy or who is suffering withdrawal from a CNS depressant should speak with a physician or seek immediate medical treatment. The two main categories of drug addiction treatment are behavioral and pharmaceutical.
Behavioral treatment. Behavioral treatments help patients stop drug use by teaching them strategies to function without drugs, deal with cravings, avoid drugs and situations that could lead to drug use, and handle a relapse should it occur.
Pharmacological treatment. The pharmacological treatments counter the effects of the drug on the brain and behavior, and can be used to relieve withdrawal symptoms, help overcome drug cravings, or treat an overdose.
This is our works cited, and thanks for watching. Hope you learned something.